All right, so today we're going to talk about orthodontics and referrals. This will be an analysis of a little bit of history, why referrals are necessary, and some research done by the Jaycox lab at UNC. So when we talk about orthodontics, we're actually talking about one of the oldest branches of dentistry. Ancient Egyptians and Greeks already experimented with earlier techniques of braces, though luckily for us, their materials and techniques didn't survive into modern practice. Things became more scientific in the 1800s, and Dr. Edward Engel, often called the father of modern orthodontics, formalized classifications of malocclusion and helped establish orthodontics as its own specialty. So even though aligners and digital planning feel new, the field has a very long foundation. It's easy to think orthodontics is just about straight teeth, but specialists actually focus on building a bite that functions long term. They have deep training in craniofacial development, biomechanics, and how teeth, bone, and soft tissue interact over time. So orthodontics isn't just cosmetic, it plays a big role in chewing efficiency, airway development, and preventing dental relapse. General dentists are incredibly skilled, but orthodontic cases vary dramatically in complexity. Some situations, like early interceptive treatment or growth-related issues, really do require a specialist's experience. Orthodontists spend years studying tooth movement biomechanics and how to guide development safely. So referrals aren't about passing off patients, they're about making sure each patient gets the best possible outcome. For patients, referrals help ensure the treatment plan is the right one for their situation. Strong partnerships between dentists and orthodontists improve communication, which ultimately improves the quality of care. And because orthodontic movement affects bones, ligaments, and airway structures, getting the right eyes on the case is key for long-term stability and safety. So the Jaycox lab takes all of this a step further by asking what actually drives dentists' decisions. And this was paraphrased the title of one of their papers, and so now we're going to analyze that exact paper. They looked at why dentists treat certain cases themselves, why they refer others, and how they choose specific orthodontics, even whether they feel prepared by dental school. It's the first study I've seen that ties together education, communication, and referral behavior in such a comprehensive way. One of the surprising findings is how many general dentists now treat orthodontics themselves, mostly using clear aligners, but even with that, they still refer about two-thirds of cases. The biggest factor in deciding to refer is complexity, which really confirms what we talked about earlier. Patient age is also a major factor because younger patients need growth-related intervention. And when dentists do refer, they focus on specialist list skill, proximity for the patient, and most importantly, patient satisfaction. To me, the most interesting part of this study was the communication findings. Even though dentists overwhelmingly prefer email, the most common method of communication actually used is the phone. Younger dentists in particular wanted communication to be digital, efficient, and clear, and across all career stages, communication quality, not gifts or personal connections, was the number one factor in maintaining strong referral relationships. In other words, communication isn't just a courtesy, it directly shapes the patterns of care. Finally, the study highlighted a major educational gap. Most dentists felt their orthodontic training in school wasn't enough, and only a quarter actually managed orthodontic cases during their dental school education. As a result, many rely heavily on continued education, and this gap influences what they feel comfortable treating and when they choose to refer. It shows how important strong training is, not just for specialists, but for anyone guiding patients through orthodontic decisions. Thanks for listening, and here is a list of references. Bye bye.